I'm now joined by Dr. Abhishek Raut, Medical Director at Appletree Medical Group, to discuss the Movember movement. Dr. Raut, thank you for joining me today. Now, how big of an impact has Movember had on men's physical and mental health?
Well, Movember now has really evolved into a significant global movement focused on raising awareness about men's health. And what we've seen is really an evolution on both physical and mental health. So, in terms of physical realms, awareness and early detection is a big focus. For instance, prostate cancer, which is one of the most common cancers in men. We also see a promotion of preventative care. So, looking at the fact that men are less likely to visit healthcare providers compared to women, actually about 80% less likely to have seen a doctor in the past year. It also looks at physical activity and lifestyle changes. And now, more importantly, we're looking at the mental health impact as well. So breaking the stigma. There's a big role that Movember plays in breaking the stigma surrounding mental health for men. Suicide prevention. Suicide rate is still the leading cause of death of men under 50. And with men accounting for about 75% of all suicides there. So Movember certainly helps target all of these issues, which in many ways still remain taboo for men's health.
Now, you did just mention that women typically are more open to talking about their physical or mental health. But how much has this movement opened the door for men to feel more comfortable to talk about those serious topics with each other or with doctors?
I think it certainly has helped. It has opened the door in many ways. I think the big one has been a cultural shift. So Movember has really contributed to this a cultural shift where people can discuss mental health, especially men discussing it with other men as well, and using the mustache as a good conversation starter or a good reminder to break the ice on these topics there. There's certainly a big increased awareness part of this as well. So what we are seeing is men in general less likely to seek help for mental health issues, but having Movember the focus of this and a good reminder with a mustache is very helpful as well. And then finally, it really has facilitated the creation of a lot of support networks where men can share their experiences and feelings.
Now, you did mention prostate cancer, which is the most common cancer in men, with one of every 8 Canadians being diagnosed in a lifetime. Would you mind explaining what prostate cancer is and why it's so common?
Right. So prostate cancer is a type of cancer that occurs in the prostate, which is a small walnut-shaped gland just below the bladder. And this gland really plays a crucial role in producing seminal fluid, which helps transport sperm. Prostate cancer typically begins when the cells in the prostate start growing uncontrollably and they form a tumor. Now, prostate cancer can grow slowly and some may not cause significant harm, but some can be very aggressive. And what we see is age plays a very strong role in it. About 99% of cases happen after age 50. We see genetics playing a strong role. Men with genes such as BRCA1 and BRCA2, which we link with breast cancer for women, certainly linked with higher prostate. We see ethnicity as well. So Black men have a higher incidence and are more likely to develop the aggressive form cancer. And then certainly lifestyle factors in there, obesity and dietary habits can contribute to the risk as well.
Now, the prostate exam, for lack of a better word, is seen as not the most enjoyable checkup. How important is it for society to break that stigma around the process so more men feel comfortable going to get checked? And when should men be getting checked?
Right. So yeah, we certainly see that there. There is still a lot of avoidance for the digital rectal exam or the DRE, and that avoidance can, of course, cause significant health implications as well. So I think the important thing is really encouraging that preventive care. Many men will choose to avoid prostate exams because of embarrassment or fear, but that can certainly delay the treatment of prostate cancer. We certainly see this changing perceptions of masculinity, which the stigma often tied with traditional notions of masculinity. Now we're seeing a big cultural change with that as well, which is very helpful. And certainly there are mental health benefits as well. You know, the concern about feeling judged or feeling ashamed can lead to a lot of anxiety and isolation. So certainly an open dialogue is very helpful as well. And then finally, having that community support. What we are seeing is men talking to other men about many checkups, including the digital rectal exam, and how to really go forward after 50 at the very least to have a DRE done.
Dr. Rout, thank you so much for the time today.